Live from Los Angeles, this is Amir Lahiji. So, how was your Saturday? I hope you had a very good time, right? Okay, very good, very good. So, let's going on. What's going on here? Oh my gosh, lots of people is here. Very good. Thank you, thank you, thank you, thank you. So, let's jump to the. Let's go. Let me tell you what's going on. We had lots of people. They watching from different countries with a different field. They have a professional job. They are doing different things. But now they're working from home, right? So, wow, we have a dancer. They are waiting here. Very good, guys. Be patient, please. Thank you. Be patient. Very good. Thank you. So, yes. So, for I suppose jump to the New York, but before New York, I want to go somewhere else. But I want to tell you something. Lots of, you know, people they are professional. They are doing different businesses, but now they are working from home. It's good and bad, but all the time I said, when you cannot go outside, go inside and find something inside, right? So, but I have one of very good viewer from Canada. She's on air. Hello and welcome.
Hi, Amir. How are you?
I'm good, thank you. How are you?
I am good. Thanks for asking.
So,
Uh,
how's
can you
your
guys hear
network?
me? Because I think it's kind of cooperating with me.
I can hear you, but
Okay, then if you can.
I want to just make sure connection is good, your network is good. Where are you from?
I am originally from Iran,
Oh,
Iran.
okay,
Yes, Persia, and it's been a while that I live here in Toronto.
okay. Nakisa, what do you do in Toronto?
So my full-time job is that I'm a recreational therapist working with Alzheimer dementia patients. We
Mm-hmm.
do a lot of non-clinical therapies with them. However, since this quarantine has been affecting everyone, and since fitness and nutrition and health is a passion of mine, I've been focusing a lot on fitness and nutrition during this quarantine.
Okay, you said nutrition and fitness too, right?
That's correct.
Okay, very good, amazing. So, how you manage with all these things happen? What do you do? Do you work from home?
I do. Honestly, this is a very hard time for everyone from all around the world. However, if we want to look at this in a positive way, I think this is an opportunity for all of us to kind of step back and focus on working from home, which is for me is focusing on fitness and nutrition since I'm not able to work with my patients one-on-one at this point. Um, However, working from home has its own pros and cons. Therefore, again, I'm not focusing on the cons and I'm only focusing on pros. That's exactly what
Okay,
I've
and
been
then this
doing.
is you, right? You doing from
That
home.
is correct. Yes.
It's
We
good.
don't have any gyms around, so
Okay,
I have to use any props around me to be active and to keep my shape.
amazing, amazing. So, uh, before COVID-19, what was your daily job? Exactly. Tell me about more. I want to. I like to know more about you.
So, as I mentioned, I'm a recreational therapist. I work
Right.
with Alzheimer dementia patients, and
Mm-hmm.
before working with Alzheimer patients, I was working with a lot of like different population, from kids with disabilities, mental and physical disabilities, to children who are just who are not even challenged at home,
Mm.
but kids who are developing and they're trying to with their stress and anxiety and all of that. So our job is basically to take this step back and see what the bigger picture is. see the problem, and then based on that problem and based on what their interests are, choose the proper intervention to bring their anxiety and stress down and give them like a sense of accomplishment and confidence. So
Interesting.
that's a little bit like very short introduction about my full-time job. However, as I mentioned, I've been doing fitness and health more seriously recently because of this COVID-19, and I've been doing professional figure skating, professional snowboarding, and professional bodybuilding for quite a couple of years. I
Oh
would
my
say
God.
over 20 years.
Okay, and the like this bodybuilding like this.
That is
Okay,
correct.
okay. So
Yes.
let me adjust myself. Okay.
Yeah, you have a poor posture. You need to work on that.
Okay, definitely, definitely. Let's wait, and after all these problems, I need more people to work here, and then I have more time. Let's go. I want to talk to you more about different things, but we spoke about boundaries last week, couple of times, and I want to jump to the. Let's go to New York and see Dr. Mitra Koramshahi is here or no. Hello and welcome.
Hello, how are you?
I'm good, thank you.
Thanks
How
for
are you?
having me.
It's my
Hi.
Very
pleasure.
good.
My pleasure. Very good.
So
Nakisa is here from Toronto.
nice meeting you, Nakisa.
Nice to meet
Basically,
you. Same here.
great pleasure meeting with you.
Thank you.
Likewise.
So, uh, Dr. Koram Shadi, I like to ask you about boundaries. So, this word is not familiar with all culture, Persian culture, but in the different countries, they have some issue with boundaries. Uh, I can see in Los Angeles, lots of American people still they have a problem with this, and they don't know its issue. They thought, oh, it's normal, but it's not normal to. However, you want to say a positive compliment, oh, you look better. Your dress is much much better. Oh my gosh. Oh wow. Then they pass the boundaries, right?
I get your point actually, but since I'm working with the in neuroscience and
Mm-hmm.
physioanatomy of the brain,
Mm-hmm.
I always love to make a connection between the neuroanatomy, neuroscience with the the behavior, the feeling, and what
Mm-hmm.
we are dealing as a regular daily basis. As you mentioned that there is a different culture for the boundaries, but I want to make sure that before the boundaries, we have to know what is the attachment, what
Mm-hmm.
is the connection, and what is the communication within us. As
Exactly.
you know, probably that we are familiar with the Dr. Bowlby attachment theory 50
Right.
years ago. And
Mm-hmm.
after that, Dr. Alan Shore was trying to make a connection between the new modern of the psychiatry, psychology, and behavior. And as
Right.
you know that, previously they were so concerned about the behavior therapy and
Mm-hmm.
behavior theory. And then they switch it to move it to the cognitive therapy and
Mm-hmm.
cognitive theory. And now they are, focusing on the emotional therapy and emotional, theory. So it's a kind of, move from one point to another point. But the fascinating aspect of the brain and neuroanatomy is that we do have two parts of the brain, right
Mm-hmm.
side and the left side. And it's very interesting that when we are in the uterus as an infant, as a fetus, actually, we do have a very critical period to have a developed neurons which will work with us, for the rest of our lives. But the previous theory was mentioning that, before birth and after birth. Before birth, they were talking about the genes and how our life is controlled with the genes. And after birth, they were talking about the environment and how we get, more
Affected.
mature, more developed with the, environment. But this theory is not anymore,
Accurate.
accurate and valid, actually.
Valid.
I should say that we do have one period before the, giving birth to the infant to come to the world, which is the 270 something days. Sometimes it's 280 days. It depends on the duration of the pregnancy. And after that, we do have 2 years after the giving birth to the child. And this is continuously developing the neurons in the brain since living in the uterus and then come to the world, which is almost 1,000 days. And in 1,000 days, we do have enough time to develop all of the neurons and their function for the rest of their life. And the most important part is that the right side of the brain, which is associated with the emotional functioning, social functioning, empathy, all of them are related to the right side of the brain. And the left side of the brain is, responsible for doing the logic, executive functioning, having the calculation, all of this stuff. And we need both sides. We need the right side and we need the left side of our brain to work as a healthy, functional individual in the society. Unfortunately, the majority of the people doesn't have this integration between the right side of the brain and left side of the brain. So that's why we do have dysregulation of the affect. And when we do have the dysregulation of the affect, we cannot translate the external stimuli to our brain, and then based on that translation, we have a very appropriate type of the behavior. So it depends on the people, it depends on the culture. We do have the different type of understanding, interpretation of the events, and based on we do have the attachment with the first caregiver, which is kind of permanent caregiver, and we repeat and repeat and repeat this type of the behavior with our primary caregiver to our different relationships. So it doesn't matter that you are 16 years old or you are 60 years old. So you are returning back to the same pattern that you had with the primary caregiver. So it's a little bit deep and a little bit need more consideration when we are talking about the boundaries. And in psychiatry, in psychology, people we have to know that boundaries, when we do have the relationship with the patient, it's totally different. When we are talking about the normal boundaries, we are talking about two different individuals with the same conscious level of the mind. But in a therapeutic relationship, we don't have that. One is in deeply pain with the objective point of view, and the other one, which is the therapist, is in subjective way, and has a little bit understanding about what's going on. So it's totally different in the therapeutic relationship until the boundaries will set up during the therapeutic relationship in patient and physicians.
So you mean it's better before talking about boundaries, we should talk about attachment?
Absolutely, yes.
Okay, so it's very good point. I like it. And so, could you please tell us? We have a different type of attachment. So, could you please mention different type of attachment? And then I have another question.
Sure. First of all, we have to know
And
that what is
also,
the
sorry, before you start, could you please adjust your angle because you are not in the center of the. No, other side, more. Perfecto. You are in the center.
cool.
Amazing.
Very
Okay,
nice.
please, thank you.
All
Go ahead.
right. Since we have to know that we do have a couple of type of the attachment. The most
Mm-hmm.
important and the healthy one is the secure attachment.
Right.
Secure attachment means that the infant or the child does have understanding about the a gesture, a facial gesture of the caregiver, which is
Mm-hmm.
usually his mother,
Mom.
and
Should be mom.
usually it is.
Yeah, should
It's
be.
sometimes the
Yeah, should
caregiver.
be is not. But the good and healthy one is if it's mom and if it's home, then gonna be healthy. If it's mom and going to work and come back and going to work and there is a two
Not
different person,
consistent.
then gonna be problem. And which kind of problem? Which kind of problem that person gonna should be deal with that when is it two different caregiver.
It depends on the relationship with the caregiver. It doesn't matter that how many caregiver do you have. You will build up attachment between all of them. But some of them are a little bit stronger, and some of them are a little bit weaker. Some of them are a little bit healthier, and the other one is not
Not healthy.
healthy as the other one.
Right.
But the problem is that the child feel anxious and
Mm-hmm.
nervous. It's a kind of bring a level of the anxiety at that point that this child when grow up as a teenager, as an adult in the society, feels all the time that there is some kind of anxious impulses inside of me, that there is no reason. I cannot find any type of the reason for that anxiety, but there is there. So that's why the majority of the people dealing with the anxiety, and after the anxiety we do have the depression, because anxiety and depression are so hands to hands, like a brother and sister.
Right.
So I believe that the first type of the attachment, which is the secure attachment, means that caregiver or mom let the child to experience the world, understand that what's going on, and make a mistake, come back again, and feel that it's okay. If I made a mistake, it's okay. I do have the facial gesture of the mom, which is accepting me, validating me, and it's secure and safe for me. But if we are dealing with the anxious mom, bipolar mom, schizophrenic mom, she is dealing with a lot of problem in daily basis of the life. She is anxious, and she is translating all of these impulses to the child, and child understand that this is not a safe area for me. So I do
Right.
have a feeling that life or world is not safe. I have
Right.
to be worried about it. So I have to have the mechanism defense. So that's why at that point all of the mechanism defense, which is the mature or immature, healthy or unhealthy, will develop at that point.
Okay, very good. So it was a very good start. And now we want to go to Nakisa. Do you have any question, Nikki?
Thank you.
Well, honestly, I love this topic because I've also I would say since I was 16, I used to live by myself, and I've been experiencing a lot of anxiety and stress because a lot of times I had to deal with many things all by myself, and I was the only decision maker in my life, and I didn't
Wow.
have like that like mom and dad figure like constantly with me. So I had to make a lot of decisions by myself, and I believe especially like for people who do experience that kind of decision making, your talks makes completely sense. And because I've been also really studying my own behavior, own patterns, and my mental health, I can see exactly where all of this is coming from, and like the ways that I dealt with anxiety. maybe if someone in my age didn't have that knowledge, would definitely have problem. And I think it's a very important topic that people have to be exposed to, and it should be discussed more. I would say, and as well as more like people have to bring awareness around this topic.
So, and now, just imagine I have a attachment problem, and all the time it's affected to my relationship. Doesn't matter with my friends, at work, or if I'm in a relationship, I'm married. Definitely gonna be makes different problem. What should I do?
Well, that's why we do have the therapist, and we do have different type of the therapy.
Mm-hmm.
Actually, when we, in psychiatry and psychology, the first step is awareness. You
Mm-hmm.
understand that there is a problem, and this is the 50% of the way that you should go. And this is
Right.
the big, big key, actually.
Mm-hmm.
So when you do have the awareness that there is a problem, now you do have the judgment that, I should do something for that. So that's why you are seeking for the therapy. You're going to see any type of, classes that may be helpful for me to change my behavior. And then, little by little, exactly like a toddler, that, we are trying to help them to walk step by step. The therapist will help, the client to step, in this road a little by little, with the guidance to understand what is my weak point, what is my, positive point, how can I, bring up a little bit more tools to my toolbox to be able to have a better daily life. So the first step is that understanding that there is a problem. This is the inside of the people. Majority of the people doesn't have the inside. They thought that, this is not my problem. There is
Right.
no, issue in me. You do have the problem, and you have to go and seek for your own problem. So you're trying to,
Therapy.
bypass it to someone else. But when you understand that, okay, yeah, could be, something wrong with me, and then, I'm going to do something for my problem. This is the first step, I believe that.
And some people they say, "Oh, I'm coming with you. Let's go to therapy. I want to tell tell him or tell her
Together.
what's wrong with you. I want to tell her." But it's still, it's at least it's good if they want to come to therapists, and therapists, they have that power to change their mind. Okay, maybe you should look at yourself and behavior.
We do have a lot of clients that they are court mandated to come to the therapy. So, sometimes the people are not coming by their own. I had a,
Yeah.
I had a patient that, he was saying that, when I asked that, why are you here, sir? He says that my wife asked me to come. I don't come.
And I heard this one in different seminar. It's so funny. We asking people, okay, why you are here? Because my wife said. It's seminar. Okay, it's so funny. Yeah, but definitely without professional help, it's very hard, and sometimes it's not possible to fix the problem. And most of the time, not sometimes, most of the time, it's not possible to fix that issue. So. I can, and say, I work so hard on myself. And most of men, they don't accept, all the time. They want to say, no, problem is you have a problem. But,
And this is culture.
yeah, I love to say all the time, I like it. I like to, say this, when you authenticity, you're going to say, okay, maybe I have a problem. Let me see what's wrong with me. So, however,
Um,
go ahead, Nikki.
I'm sorry.
Yeah.
I don't think it's like really gender like related. I think this is female and male. They all experience that. Like I've been in situations that I always try to bypass this by someone else, and then when I step back and look at myself, I see that okay, I'm the one who's constantly saying that I'm not the problem. I already worked on myself a lot. I know better, and that's you who has to go and get some help. However, in my area of expertise, we try not to focus on the medical and um, yeah, medical or clinical side of the spectrum. We try to focus more, which I believe they're both very crucial and important because it's the mental part, and then it's also the reality. So what we do is we expose clients, like patients, with activities and mostly activities that bring that to them, so they see those problems, because
Mm-hmm.
sometimes people are not to see those problems, and they have to be in a specific moment and in a specific environment and situation in order for them to open their eyes and see the problem. So for example, going back to your attachment experience, for example, with Alzheimer patients, what we do is we give them um, one of their belongings, and we create attachment around that belonging, and then like slowly we try to take it away and see how they behave, and then based on those behaviors, we expose them to activities that brings their anxiety and stress down, and help them to calm down a little bit. And it is very interesting that when you look at them, you think that okay, they have Alzheimer's, they have dementia, and there's not much that they can do in order to get better. However, it is mesmerizing that when people are exposed to these kind of activities, mostly recreational activities, because there is not a therapist involved in it, and they look at us, even though we are called therapists, they look at us as their friend, as their support, as someone who can like they can rely on,
Mm-hmm.
and it's really easy for them to open their eyes and see that that like to try to find a solution for themselves.
Mm-hmm. Mm-hmm. Amazing, amazing. So, uh, I know we spoke about having you, Dr. Koram Shadi, more than one time a week, right?
Absolutely.
Yeah, okay. Can we do it every other days? Or you'd prefer to have a every other days, evening time, or you can have your 50 minutes program, and but still you should be our guest in this program, because every time I have some question.
I'm glad to be with
It's
you
my
in your
pleasure.
program.
Thank
It's
you.
my pleasure.
Thank you.
Yes.
So we're gonna talk about the boundaries. We're gonna talk about vulnerability. We're gonna talk about lots of things. Okay, promise.
Sure. So,
Okay.
promise.
Okay, very good. Thank you so much. I know it's a late time in New York. I really appreciate for your time, and talk to you probably Monday.
Monday.
Yeah. Thank you
All
so
right.
much. Thank you. Thank
Have a
you.
good evening. Bye bye.
Thank you. You too. Bye bye. It was amazing. Very good. So, Nakisa, and now with you. Uh, with all of things you mentioned, you have lots of knowledge, and I like it. So every Tuesday at 3 p.m. Los Angeles time, we have a program. I think is very related to your area. I want to invite you to have that program every Tuesday at 3. What do you think about that? Is it a good idea?
I think, yes, it's in my honor to be a part of this program and to share my knowledge with all of the like all of our audience.
Amazing, amazing. So, and I'm sure you did your practice and you know what's the name of that program, right?
It is health check.
Yes, the health check. So, and what you want to do in that program? What's your plan?
So, as I mentioned, I am currently working on a semi book. I don't
Mm-hmm.
want to call it a book, however, like a guide for people to be able to learn about their body, but to learn about mental health for sure, because
Amazing.
I think they go and as well as health, fitness, as well as nutrition. So I
It's a
believe
good
during
combination.
these
It's very good
sessions,
combination.
yeah,
I like it.
honestly, none of them can go without the other. So it
So
is very
you mix
important that
you,
everything goes together.
you mix 2 hour program together, and now we have a
Together.
better program. And be together is better, right? Like a
Stronger.
togetherness
Thank
media.
you.
Be together in togetherness media.
Yes.
Two program in the one program, and it's good.
It's all about combining.
Yeah, yeah, yeah. So,
So
go
mostly
ahead.
we're going to talk about nutrition and diet and fitness and mental health.
Very good. We're gonna start this program this Tuesday. It's coming Tuesday at 3 p.m. Pacific time, Los Angeles time, and
And I believe it's going to be 6 p.m.
6
EST, right?
p.m. Yes, exactly. 6 p.m. New York time and your time, and whatever. I don't know where you are, guys. Just change it, and then now is a
Join us
6:36.
for this live.
Yeah, definitely, definitely. And if you have any question, in our website and our app, you can send a message right away. She can see the message and she gonna answer your questions. Good, right? Do you like it?
Yeah. Yes, great.
Very good, very good. So let's continue after a short break, and we'll come back. Okay?